All right, it's the #1 issue in American homes, getting your financial house in order. Well, today in our weekly financial fix, being able to afford to care for your aging parents. Karen Lee is the author of It's Just Money, so why does it cause so many problems? Well, Karen, it's called the sandwich generation, when adults are taking care of their aging parents and at the same time they're taking care of other members in their family. It's tough.
And we cause some of this because our generation's having children later in life. So that's why we're sandwiched together.
Oh, that's right.
This did just happen in my family. My mother, who's been living independently since my dad passed a year ago, had a pretty significant stroke, and it caused cognitive impairment. And she went from a woman who was driving 45 minutes to the airport in her SUV to come get us when we would come in to visit, to needing 24/7 care. So,
and you found out how costly it is,
well,
and really how difficult it is.
Shocked. Wait till I share with you the cost of these things. But also, there are 3 children, but all of us are still working. We're not ready to retire, and I still have 2 teenagers at home.
And so a lot of folks may think, okay, well, there's Medicare, you know, for my aging parents, and there's going to be that kind of health care. How much can you lean on that?
That's what I wanted to start with, was the Medicaid system, which is a subset of Medicare, and it is run at the state level, but it's really for impoverished people. So there are income and asset limitations that you must qualify for in order for Medicaid to cover this. Now, it varies state to state. So just as an example, I wanted to show you here in the state of Georgia, you cannot earn more than $2,094 a month. And if you're an individual, you can't have more than $2,000. As a couple, $3,000. Now, my concern there is a married couple that does have some savings.
Which is so fascinating, because a lot of folks will think, okay, well, my parents, if they have their home or it's paid for, or et cetera, they've had careers, they have all of these other things in place, but that ultimately ends up working against them as it pertains to care.
You would have to spend that down in order to qualify for Medicaid. And then, again, if you're part of a couple, you're leaving that other person without much.
And the reason why we're even talking about that is because even if you had all of those other assets, trying to afford the care per month is still, I mean, it's crippling. It's so expensive.
Let's talk about the actual cost of care. I looked at a national average study that was done by Genworth, and in-home care, hourly rate is $19 an hour. So let's say you do have a child that can move in and be the nighttime care, but they want to go to work 10 hours a day. That 10 hours of care a day is going to run $69,000 a year.
Out of pocket. In most cases.
Out of pocket. Now, in my mother's case, we wanted someone to live in the home. So there's the daily rate that we found was $216 a day, almost $80,000 a year. Fred, who can afford that? It is incredible.
Most people can't. So then how do you plan for that?
Well, and let's just quickly touch on nursing homes, which I always thought were less expensive than live-in help. Nursing homes are running for a semi-private room, $70,000 a year, for a private room, almost $78,000 a year. Assisted living is more reasonable at $39,000 a year, but this is when your parents still can do some care for themselves. So what do you do?
How do you plan?
How do you plan? So the first thing, of course, is long-term care insurance, and it is a very good option, but understand it's expensive, and you got to be healthy to qualify for it. So start with this. Ask your parents, do you own a long-term care policy? Hopefully they do. Look at the adult children, if there are any, and ask who is in a position to perhaps step in and provide some care for mom or dad. Maybe someone who's already retired, maybe someone who hasn't worked out of the home. Then
maybe they have space in their home.
Perhaps
that's something to
move the parent to that location while they're still healthy, Fred. We did that about 5-6 years ago. Moved my mother out to where my sister lives because she was our choice of the 3 kids that would be able to step in. Now, here's an idea for people our age. Let's say your parents don't have the insurance, but are healthy enough to get it, but can't afford it. The adult kids could chip in together and pay those premiums on a long-term care policy for the parents. And I highly encourage it, because
so hopefully all the siblings are in a position to be able to do that.
Because if your parents can't afford the care, it's going to come out of your pocket,
It is, and you got to take care of your parents.
And last but not least, for those who are listening who are 40, 50 years old, don't wait till you're 60 or 70 to buy it for yourself. You probably won't be able to afford it either. So start looking at long-term care while you're younger.
Great advice. All right, thanks so much, Karen Lee. Appreciate that, and all the best for your mom.
Thank you so much. Thank you.
And get more information by reading Karen's book, It's Just Money, So Why Does It Cause So Many Problems? Or reach Karen at KarenLeeandAssociates.com.